If you believe fluoridation is forced medication, please be assured that fluoridation at the recommended amount is completely safe and effective in helping to prevent dental decay. The purpose of controlled fluoridation of drinking water is simply to add on to already existing levels of fluoride in water to produce optimal health results. Water fluoridation has been around since the 1920s when a Colorado dentist named Dr. McKay discovered that people living near water sources with fluoride had significantly lower tooth decay rates than the rest of the population. Since then, researchers have found scientific evidence showing that fluoride decreases the risk of tooth decay, and many cities began adding fluoride to their water supplies. In fact, today, 87% of National Hockey League home cities add fluoride to their municipal drinking water. This decision to fluoridate makes sense because of fluoride's safe and beneficial effects. Back in the 1940s, when Brantford, Ontario became the first Canadian city to fluoridate its water, Brantford children had a 63% reduction in severity and a 35% reduction in the prevalence of cavities. So why doesn't Calgary have fluoridated water? Before we get into our city's controversy, let's first talk about how fluoride works, starting with the basics of tooth decay. Cavities, or dental caries, form when the enamel of teeth melts away to expose the nerves inside, allowing bacteria to penetrate the inner layers of the teeth to cause a painful infection. Tooth enamel is formed from a calcium and phosphate mineral. On the surface of this enamel, there's a layer called plaque, which consists of naturally occurring bacteria. In normal teeth, minerals move back and forth between the enamel and plaque, forming an ionic seesaw. Eating food can cause the bacteria in plaque to produce acids that dissolve this tooth enamel. When enamel loses ions at a faster rate than it gains ions, cavities can form. Untreated cavities can destroy the tooth, causing pain, and may also spread the infection into the roots and gums surrounding the tooth. Fluoride can make enamel stronger and more resistant to tooth decay. In young children, fluoride can directly incorporate into the developing enamel to make teeth more resistant to acid attack. Fluoride can also help the teeth to develop a smoother texture, decreasing the ability of bacteria to grow and to produce acid. Despite the known benefits of water fluoridation, Calgary continues to experience backlash from citizens who oppose it. In 2011, the majority of our city councillors misjudged the health importance of fluoridation and decided not to continue it. As vibrant, socially conscious citizens of the city, we encourage you to understand the health benefits that fluoridation has for you, your children, and for the more vulnerable members in our society who may not have access to the dental services many of us take for granted. The choices you make within your ward, and the choices your councillors make, affect the entire city of Calgary. Depriving the population of fluoridation not only unfairly increases risk of oral disease for Calgary's most vulnerable, but increases the need for dental care for all. Your teeth are not immune to decay. How exactly does water fluoridation help everyone? Water fluoridation is a public health intervention. As per the World Health Organization, public health prevents disease and promotes the health of the population as a whole, rather than just individual patients. We all deserve to be healthy. In Alberta, dental care and thus fluoride is a privately insured health service that is not available to all, meaning that individuals who are able to afford dental care have much better oral health outcomes. In Calgary, the cost of an annual dental checkup varies from $151 to $265, a cost that is simply unimaginable for low-income families. Therefore, it is the most vulnerable individuals in our society that benefit most from water fluoridation. When Calgary removed its fluoride in 2011, how was our dental health affected? A recent University of Calgary study found that grade 2 students in Calgary had approximately 3.8 more cavities in 2013 to 14 than in 2004 to 5. But in Edmonton, which continues to fluoridate its water, the tooth decay increase over the same time period was just 2.1. These findings and more are supported by many well-recognized organizations, including the Canadian Dental Association. Fluoridating water is one of the greatest preventative measures we have in the fight against dental decay, said CDA President Dr. Ron G. Smith. The U.S. Center for Disease Control and Prevention also recognized fluoridation as one of the 10 most important public health interventions over the last century. cost-benefit analysis studies have found that the long-term costs of water fluoridation are lower than the costs associated with cavities and other related dental issues. In Calgary, the costs associated with fluoridation were approximately $750,000 per year. That might seem significant, but in reality, it amounts to around 63 cents per person annually, a tiny fraction of what a trip to the dentist costs. It is clear that water fluoridation is a sensible long-term investment for our children and for our population as a whole. Lastly, a concern sometimes raised over water fluoridation is its perceived side effects, including fluorosis, which is a buildup of fluoride on the teeth visible as white patches. However, the concentration of fluoride in fluoridated water is minimal, not enough to cause fluorosis on its own. Some also argue that fluoride may be a toxic chemical, but in fact you would need to drink 833 cups of water fluoridated at the maximum allowed level of 1.3 milligrams per liter in a day for fluoride to be lethally toxic. Is this realistic? No. Besides, fluoridated water typically has much less fluoride content than the maximum regulated level. We encourage you to take initiative to address the problems that have already arisen due to lack of fluoridation in Calgary's water. There are many steps you can take right now to address this issue. Please publicly speak out in support of fluoridation. Write letters to the editor of the Calgary Herald and Sun. Share the link fluoridation.care with your friends and others. Ask your candidates during this municipal election to support the reintroduction of fluoridation to our water supply. Support those candidates in their campaigns, and above all, remember to vote on October 16, 2017. Together, we can make a difference.